Imagine a world where a dog doesn't just live beside you, but helps you heal, physically, emotionally, and sometimes even medically. Therapy dogs are common today, used in hospitals, schools, and disaster recovery sites. But this idea didn't appear out of nowhere. The bond between humans and dogs, one of comfort, loyalty, and safety, has ancient roots. And over centuries, that bond evolved into something remarkable: structured, evidence-informed therapy that can support real health outcomes. In this video, we'll trace the evolution of therapy dogs, from ancient history and early working traditions, to modern programs, training methods, and the medical miracles many people witness today. Let's start at the beginning. Number 1. Ancient origins. Companionship as healing. Long before therapy dog was a formal term, humans recognized something powerful. The presence of a calm, friendly animal could ease distress. We can't pinpoint one exact moment when therapy dog culture began, but history suggests that dogs were often linked with comfort, especially for people facing hardship, isolation, or illness. In ancient societies, dogs served many roles: guardians, hunters, companions, and their presence was often associated with protection and emotional stability. While medical care looked vastly different from today, caregivers and families still understood an important pattern. When a person feels safer, supported, and less alone, their stress decreases, and stress affects health. That idea, animal companionship reducing loneliness and fear, became a recurring theme throughout human history. The dog wasn't just a helper. In many cases, the dog was a presence that made life feel more bearable. Pause, reflective, and as societies grew more organized around health, education, and institutional care, the groundwork was being laid for something closer to what we now call therapy. Number 2. Early documented therapy concepts. Comfort in institutions. As we move into more documented historical periods, we start seeing a shift. Animals being introduced into settings where people were vulnerable, such as hospitals, asylums, and homes for the sick or displaced. The key difference is that the why begins to sound more familiar. Instead of simply valuing dogs for their loyalty, institutions began experimenting with the emotional and behavioral impact dogs could have on patients. Think about the challenges of those settings: limited privacy, loneliness, long stays, and anxiety. Even with compassionate staff, people in institutions often had fewer social connections than they needed. Dogs, with their calm demeanor and non-judgmental companionship, could help fill that gap, sometimes encouraging engagement when patients otherwise withdrew. Number 3. Modern turning point. From companionship to programs. By the 20th century, the world started moving faster. New understandings of psychology, rehabilitation, and patient-centered care began to influence hospitals and schools. This was the era when therapy dog started to become more than an informal practice. One major driver was the growing recognition of how emotional well-being affects physical outcomes. Anxiety can worsen pain perception. Depression can reduce motivation and hinder recovery. Loneliness can slow progress by lowering energy and engagement. And dogs, through touch, eye contact, gentle interaction, and predictable routines, could help patients feel more connected and regulated. This is also when training begins to matter more. A dog used for therapy can't be randomly picked or loosely supervised. For therapeutic use, temperament is essential. The dog must be calm in busy environments, tolerant of wheelchairs and hospital sounds, and responsive to handler guidance. So the evolution becomes 2 tracks: the human understanding of why companionship helps, and the dog training systems required to make that help safe and consistent. Number 4. How therapy dogs are trained for real-world impact. Let's talk about what it means to train a therapy dog for modern settings. A true therapy dog program typically emphasizes temperament, calm, friendly, and steady under stress; reliability, predictable behavior around strangers and medical equipment; distraction training, handling noise, movement, and crowded spaces; basic manners, no jumping, respectful greetings, leash skills; handler teamwork, The dog responds to the handler's cues, and the handler manages the environment. The point isn't to create performing dogs. It's to create dogs that can remain emotionally stable while supporting someone else's emotional and physical needs. And just as importantly, therapy dogs aren't just pets. They're working partners within guidelines that protect both patients and dogs. Number 5. Therapy dogs in healthcare. Comfort, motivation, and sometimes measurable outcomes. Now we arrive at one of the most talked about areas, therapy dogs in hospitals and care facilities. Where do they help most? They often support patients dealing with anxiety or fear before procedures, during treatment, or while receiving uncomfortable care. Rehabilitation environments, where encouragement can boost participation in exercises and movement. Long-term care residents, where companionship can reduce isolation. Children in medical settings, where play and gentle interaction can make experiences feel less intimidating. In many settings, therapy dogs also serve as conversation starters. For someone who has trouble speaking, whether due to illness, trauma, or communication challenges, the dog can break through barriers, and sometimes the impact becomes visible in measurable ways. Lower stress levels reported by patients, improved mood, calmer behavior in certain clinical settings, and increased engagement in therapy sessions. To be clear, therapy dogs aren't a replacement for medicine, but they can complement treatment by improving the emotional environment where healing happens. Number 6. Therapy dogs for mental health and emotional recovery. Beyond hospitals, therapy dogs play a major role in mental health support environments. Consider people recovering from trauma, depression and loneliness, anxiety, grief, the stress of chronic illness. A dog's presence can offer structure, daily routines, a reason to get out of bed, and a feeling of being needed. Many people describe the comfort of a non-judgmental companion, someone who doesn't demand explanations, doesn't criticize, and doesn't disappear when emotions get difficult. In therapy programs, such as guided sessions, dogs can help reduce defensiveness and encourage interaction. In some cases, they can also support grounding techniques, where focus shifts from overwhelming thoughts to present sensations. The dog's warmth, the sound of breathing, gentle touch. Number 7. Schools and reading programs, emotional support through literacy. Therapy dogs also became popular in schools, especially around reading and confidence building. There's a reason this works. Reading can feel vulnerable. Many children fear being judged for mistakes. A calm dog offers an accepting audience, one that doesn't correct them or tease them. Over time, school-based programs emerged where children read to dogs, build fluency, and practice communication in a low-pressure setting. The dog becomes a bridge between learning and confidence, helping students persist when reading feels hard. And while this may not sound medical, educational well-being strongly affects mental health. Confidence, reduced anxiety, and improved engagement can create better learning outcomes, and that's part of the broader picture of health. Number 8. Service versus therapy, clearing up the difference. This is a great moment to clarify something quickly. Service dogs are trained to perform specific tasks for an individual with a disability, like guiding someone with vision loss, detecting medical events, or assisting with mobility. Therapy dogs are trained to provide comfort and support to people in settings like hospitals, schools, nursing homes, and community programs. They work with many people, typically under a handler's guidance. Both are incredible, but they're built for different missions. Number 9. Modern medical miracles, the why it matters moment. So what makes therapy dogs feel like modern medical miracles to so many people? It's not magic, it's mechanism. The dog can reduce threat perception, can lower stress, can encourage human engagement. It can create positive emotional experiences that make recovery feel possible. And when a patient is less stressed and more willing to participate, clinicians get a better chance to support progress. Some people describe their therapy dog experience like a turning point, a moment when fear lifted, motivation returned, or loneliness felt smaller. Those stories matter because health isn't only biology. It's also behavior, emotion, connection, and meaning. Number 10. Safety, ethics, and the future of therapy dogs. As therapy dog use grows, programs also face growing responsibility. Modern therapy dog standards increasingly emphasize protecting patient safety, protecting dog welfare, clear guidelines for where dogs can go, ensuring the dog isn't overstimulated or stressed, handler oversight and proper health checks. The future likely brings better assessment tools, more data on outcomes, improved training methods, and more tailored programs for different populations. We may also see expanded research into how therapy dog interactions affect stress hormones, pain perception, and recovery markers, which intervention styles help most, how to match dog temperament and patient needs more effectively. But the core idea remains timeless. The bond between human and animal can support healing. So the evolution of therapy dogs, from ancient companionship to structured modern support, shows how human compassion and animal loyalty can combine into real-world help. Therapy dogs didn't begin as a medical technology. They began as something simpler, a calm presence that made people feel less alone. Over time, that presence became organized, studied, and refined, turning comfort into a practical part of modern care. If you enjoyed this journey through history and healing, consider liking the video and subscribing for more stories about the science behind the seemingly magical. And one question for you: where do you think therapy dogs make the biggest difference? Hospitals, mental health settings, schools, or something else?